passively goes into my right atria, yes?
Mhm.
From muscle movement, yes?
This one CHF.
This is CHF, yeah. So passively goes into my right atria. My right atria fills up, the sinus node fires, the right atria goes squidge and shoots it into my what? My right ventricle, right? Then my right ventricle goes squidge and shoots it where?
Almond.
Into my lungs. This is venous blood flow. Dark blood because it's missing what?
Oxygen.
Oxygen. So it goes to my lungs. It does the gas exchange. Goes into my left atria. My left atria goes squidge. Goes through another valve into my left ventricle. Yes? Actually, that's not a valve. This is a valve. And then it goes to the rest of my body. Okay? You guys know how to memorize your valves for the blood flow? What's the phrase? Are you ready?
Yeah. Where were you last semester?
Toilet paper, my ass.
Oh, that's right. Mike up to
Tricuspid pulmonic. Why is it the pulmonic? Because it's going to
To
my
the
lungs.
lungs.
Pulmonary. Mitral valve aortic. Why? Because it's going to my aorta. Toilet paper, my ass. Blood flow. Past the valves. Okay? Y'all got that?
Yep.
Cool. Now, my left ventricle. I gained, God forbid, 400 pounds. Right? As I'm eating my bonbons and my Cheetos and my 99-cent heart attacks in a bag, I get like big and fluffy. Gigantic fluffy. What happens to my heart? It gets overworked, doesn't it? What happens when we get an overworked, floppy, moppy heart? Is it still an effective pump? No, it doesn't go like this. It goes, right? So I'm not ejecting my blood, all the blood out of my ventricle into the rest of my body. So it starts backing up. Where does it end up backing up to?
lungs.
My lungs. My lungs. This is left-sided heart failure. That's why when patients with left-sided heart failure, now I've got all this fluid hanging out in my lungs, and we've got the laws of osmosis. It leaks out of my circulatory system into my lungs. So what do my lungs sound like? What? Yeah, they get crackles. Does that make sense? There's your review of PAPA. Right? Now, God forbid, my right ventricle gets floppy moppy too. Where is it going to back up to? That's why we get lower extremity edema. Weight gain. They're holding onto the fluid. Congestive heart failure. Symptoms, fluid overload. Easiest way to fix fluid overload. Here's a magic phrase for you. You ready? Salt sucks. You start eating them Cheetos, your body says, we're going to hold on to the water.
Sure makes it easy.
Alright? Two other things in your universe suck. You ready? Sugar sucks.
Sugar.
Protein sucks. All three of those will make you retain water. That's why dialysis patients are on low protein diets. for retaining the fluid. That's why congestive heart failure patients are not allowed to play with their salt shakers anymore. Okay? Congestive heart failure. Simple rule. What do we have to teach patients when they have CHF? Diet restrictions, so low sodium. They need, smoking. They need, please God, they need to take their meds. And they need to weigh themselves every single day. This is the reason why I used to beat my techs up. I'd come in and go, how come there's not a weight on Mr. Smith? Well, I didn't want to wake him up. Use the bed. Now we have beds that do it, right? You don't even have to wake him up. But back then, I didn't want to wake him up. I'm like, damn it. Weight gain is the #1 best way to know if somebody's retaining water. If they gain 2 to 3 pounds in 2 to 3 days, I can guarantee that's water weight. Wake them up. Use the bed if you've got the newer beds. 2 to 3 pounds in 2 to 3 days. It's all water weight. How much is 1 pound of water weight? How many kilos? 2.2 pounds is 1 kilo, right? Dude, they start gaining the water weight. We gotta call the doctor and ask for a what?
Diuretic.
Diuretic, good. Love it when it comes together. You guys remember what I taught you about potassium?
Yes. Too much, too little. Yeah.
Right? How many of you have seen those nasty little yellow packets called Mrs. Dash on your patient's trays, right? Throw them away. What is the chemical prescription for salt? What do we call it? If I wrote it out chemically. Sodium what?
Chloride.
Guess what Mrs. Dash is made out of?
Sodium chloride.
Potassium chloride.
That's crazy.
Now why do they give it to them?
Because they're more worried about the salt than they are the potassium. Oh, but Miss Howard, the food tastes like shit in hospitals. What are they supposed to use? Lemon juice or lime juice. Call the kitchen up and say, can I get a couple slices of fresh lemon, please? All right? It'll do the same thing. It'll add flavor, okay? Get rid of those Mrs. I hate that shit. All right. So they need to weigh themselves, they need to take their meds, they need to get off their butts and exercise, they need to lose weight. All right, rhythms. This is what happens when you get a cardiac nurse. I don't even need to look at my notes. The other day I heard Dr. K doing this, and she started using my baseball analogy. I'm like, I know where you stole that. All right. You had Dr. K?
I heard that this week.
Did you?
Yeah, that's why.
All right, so if this is the electrical pathway of the heart, and this is the right atria, who's this sitting up here in the corner? Yes, I know, very good. What is his intrinsic rate?
61.
Beautiful. Who's the gatekeeper who hangs out in the middle?
That's
AB node, also known as the junction. What's his intrinsic rate?
40 to 60.
40 to 60. You guys see the trend here? Who are the guys at the bottom of my heart who's going to rescue me when those other two die?
The Purkinje.
The Purkinje fibers. My second favorite word only to phalanges. All right, what's their intrinsic rate?
30 to 40.
You're close.
20 to 20.
20 to 40. Look at the trend. Look at the trend. You see it? 20, 20, 20. Yes, no, maybe?
Yep.
Okay, so sinus node. He gets all happy, he shoots, he scores. He goes through the junction, yes? And then he goes down into here, and everybody just goes squidge, and we're all happy. That's the normal electrical pathway of the heart. Well, how do we see that on the bumps and squiggles on a machine? It took me years to be able to draw like this, guys. Alright, who's this guy?
P. P wave.
Who said it? Good job. Atrial depolarization. Alright, the sinus node goes shoot, sends the electricity through the atria goes squidge, shoots it into my ventricle. Okay? The PRI, or the PR interval, needs to be less than 0.20 seconds. Well, what does that mean, Miss Howard? It means when you look at a telemetry monitor, this is time, this is amp. One big box has 5 little boxes, yes? Each little box, 0.04 seconds. 0.04 times 5 is? Huh?
0.20.
You better say 0.20, am I right? Okay. That's how we do the time. Who's this dude? The QRS. You notice he is upright and skinny? Yay, that's what we love. We love upright and skinny. Upright and skinny is awesome blossom. We love upright and skinny. That means the electricity is passing the right way through the junction and into the ventricles. So the QRS is ventricular depolarization. It's firing through, and what happens when we depolarize? We go squidge. It contracts, shoots the blood out. The QRS needs to be skinny. Am I right? Am I still good on my numbers? Okay, good. I'm waiting for them to change the numbers. I'll be like, damn. Who's this dude?
RT.
T-wave. What's he show?
Repolarization.
Repolarization of the ventricle. Very good. It's like waves of grass. It has to reset itself before it can fire again, okay? So this guy right here, to the end of the T wave, is called the QT interval. And we really like to watch him because that's when we can find out if patients are having problems with their heart. The QT interval needs to be less than or equal to 0.40. 2 big boxes. Okay? Congratulations, that's a sinus beat. How come I don't see the atrial repolarization? It's buried in the QRS, very good. Because the ventricle's much bigger than the atrium. Good job. What's the difference between sinus tach, sinus brady, and sinus rhythm? Just the speed. Just the speed. Too fast or too slow. Okay? If it's too fast, if it's sinus tach, you need to find the cause of the tach and treat the cause, and you'll get the heart rate down. Fear, pain, fever, hypoxia. Fear, pain, fever, hypoxia, infection. If I remember right, there's 5 causes. Okay? Sinus brady, I only worry about if they're symptomatic. okay? I'm gonna tell you right now, Miss Howard, her heart rate drops from, right now I'm about 88, 89. I suddenly drop into the 40s, I will pass out. Okay? I will get dizzy, diaphoretic, and boom. However, a young, healthy athlete, sound asleep, he can have a heart rate in the 40s and it's no big deal, right? Everybody got that? Now when somebody decides, hey, I've been eating too many hardtacks in a bag. Oh, I know what I forgot to teach last week. Yes, we did. You will see do you guys see the ST elevation? ST elevation? ST elevation. Am I? That's somebody having a heart attack. Okay? But what if don't confuse the two, the last two I just drew. What's the, what do you see stands out on that one? No, tombstone is on top. The bottom one. Who's this?
T,
Who's this?
Q,
What's this?
T.
Is that T too tall? Yes. Would you say it looks like a mountain peak? That's called a peaked T wave. You put a patient on the heart monitor, you see that right now this second, you start screaming for a set of electrolytes. Okay? That is hyperkalemia. Your potassium's too damn high.
Could that cause you to have a heart attack also?
So why would you get more electrolytes if your potassium's already too high?
You wouldn't. You want, no, I want a set of electrolytes. I want their labs.
Oh.
I want a Chem 7. Or BMP. Or BMP or Chem 7. I wanna know what the potassium is. Cause if it's too high, Mr. Smith may need an insulin drip. Or some lovely drugs called K-Exalate. Look at that. Alright, so somewhere down the road, if I'm eating too many heart attacks in a bag, my SA node doesn't get all the blood it needs, he decides, I'm done. And then whatever killed my sinus node is eventually gonna kill my AV node. Now who's gonna rescue me? Purkinje fibers, your rescue beats. But guess what? Eventually he dies too. I told you, God believes in baseball. 1 strike, 2 strike, 3 strikes, you're out of here. 3 pacemakers of your heart. God believes in baseball. Now sometimes, when the junction has to take over, he draws a different funny looking picture. What's the matter with the first guy I just drew, the rhythm strip? What's missing? Yeah, there is no P. There is no P. You know why? Because this guy ain't firing. The rhythm's coming from here. It's still upright and skinny, okay? But there's no P wave, absent P wave. Or that junction decides, well, we're gonna really try and save the day, and so he fires retroactively. He fires backwards. And so we get an inverted P wave. Are you with me? That's a junctional rhythm. A junctional rhythm. What's going to be his rate? 40 to 60, right? Now you can have an accelerated junctional rhythm. You're climbing a set of stairs, the junction's like, oh dude, we're really working it. So it could be a little higher than 60. Alright, but if you get a junctional rhythm that's over 100, oh, you better go rescue that patient. That junction's working too hard. Are y'all with me? Yeah? Am I going too fast? Now you know why I told you to turn your chairs, because you're going to be drawing pictures. Here's your question, is that regular or irregular? Is there one P for every QRS? What is there? There's a whole lot of them in there. Because guess what? P wave, there's probably one there. P wave, 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 P wave. That dude's rate's probably 300 a minute atrial wise. Thank God that junction says, whoa, wait a minute. No, you don't all get to come to the party, because what's happening is instead of him being in charge, you got all these little jobbers all trying to go to the same party. So instead of your atria doing this, which is a nice effective pump, right? It's doing this. Is that an effective pump? What does blood love to do when it's just swirling around? Clot. This is fibrillation. Fibrillation. It's just shaking like a bowl of Jello. Okay? The good news is, this dude right here says, whoa, wait a minute, no, you all don't get to come into the party, only you, and maybe you. So they follow the same pathway. That's why you get upright and skinny's QRS. All right, so new onset atrial fibrillation. What kind of drugs does he need to be on? Anticoagulants, very nice. All right, and we do something called a heparin bridge. All right, when I used to teach pharmacology, I taught you guys that there was a therapeutic range, right? Therapeutic range. What's it mean when I'm below here? I'm not therapeutic, so is the drug working? No. Nah. If I'm above here, toxic. Okay, good. Heparin, we give heparin bolus because I gotta get you into the therapeutic range, yes? I gotta get you right there, right now, right there. There's 1,800 units right now, okay? And then I put you on an IV infusion, I can't write today, to keep you there. Yay! The lab we use to check that is called the PTT. Okay? PTT, prothrombin time. You are measuring the thinness of the blood. The higher the number, the thinner the blood. The higher the number, the thinner the blood. Did y'all catch that hint? If I say it 2 or 3 times, y'all better know it. Now, I can't send him home on a heparin infusion. What do I send him home on? Huh? Warfarin, Coumadin, right? Coumadin is a very slow drug. Alright? So, he kind of coasts to get up there. So at one point or another, this Mr. Jones is getting both drugs at the same time. That's fine. I gotta wait for Coumadin to catch up. And his lab is an INR. And 2 to 3 is the normal for AFib. 2.5 to 3.5 is if I've had a valve replaced. And somewhere down the road, God forbid, I'm gonna end up needing my mitral valve replaced. So I'm gonna need my blood a little thicker or a little thinner? Thinner, good. Good? You with me? That's called heparin bridge therapy. I'm bridging you to safety. Does that make sense? Oh, are you ready for my worst joke in nursing? Coming in. You can see him coming. But again, the bouncer at the door says, nope, y'all not coming in. You see how that pattern looks like? That's the same troublemakers. That's called atrial flutter.
Shark.
Atrial flutter. Any of you guys ever cut wood with a manual saw? Yeah? So if I took that manual saw and I flipped it upside down, sawtooth. Sawtooth. This is atrial flutter. It's the same troublemakers. Okay? Now, on occasion, you might see something that I affectionately call my Mickey Mouse ears. Instead of them being sawtooth, you'll see little perfectly round bumps. Don't confuse that with fib. It looks like Mickey Mouse ears. And the best way to know if it really is flutter or not, either one of them, get yourself a big old piece of that tape that the machine spews out, cut it in half. Did you learn this trick? Lay one piece over the other so they don't line up. Like, so the QRSs are offset. Hold it up to the light. And those bumps will pattern right out. Or the sawtooth will pattern right out. You'll see it. Two pieces, you take one long strip, cut it in half, hold it up to the light. It'll perfectly bounce out. Because it's the same damn troublemakers. Okay? But you get an upright and skinny QRS because it's shooting down the normal path. Okay? These guys, I worry about when they go too fast. When the gatekeeper here at the junction goes, okay, I'll let a few more of you in. Okay? Those are the only times I worry about him. Next question. Ooh. Who's this dude?
P.
Who's this?
Q.
Who's that? What the hell's that? No, it's not a STEMI. Question, no, ask yourself this. Is it wide and bizarre? Does it look like any other QRS you've ever drawn? Guess what? Then it can't be coming through the normal pathway. I'm teaching you how to read what we call lead 2. Lead 2. It's the easiest one to read, okay? It's basically following the normal pathway of the heart from my right shoulder to my left hip. It's going like this, okay? This big ugly booger he's coming from down here and he's going like this. That's why it's wide and bizarre. What do we call a baby when they show up too early? Where did I tell you the rhythm's coming from?
Purjunky.
The ventricle. Ooh, does that sound kind of familiar? Take it down the road. What am I showing you? A PVC. This is a PVC. He showed up early, because look, he came right after the T wave. All right, he came early, so he's premature. He came from my ventricle, and if you felt it, if you got a squidge from it, you had a contraction. Premature ventricular contraction, that's a PVC. And then what did I do? P-wave, QRS, T, right? Oh, but now I got two of them. What do we call two people walking down the beach, kind of liking each other, holding hands? A couple. That's a couplet. Two of them side by side is a couplet. If it's every other beat, we call it bigeminy. Now follow me down that rabbit hole. If it's every third beat, what do you think I call it? Trigeminy. There you go. All right. Now when I had my second heart attack, gave me a whole bunch of my strips that were doing that. Yeah. That is the correct answer. Sinus beat, yes? Sinus beat, right? Are you with me?
Mm.
Count the bottom points. That's a 6-beat run of VTAC. 6-beat run of VTAC. Ventricular tachycardia. If I hadn't popped back out of it, guess who was gonna get coded? Problem is, I felt every single time I did that, it woke me up. Every single time. The kid in the back of the ambulance, he's like, "You're the teacher, right?" I said, "Yeah." He goes, "Here, honey." When he dropped me off at the heart hospital, he gave me a big old wad of my strips. And I was looking at it going, now I know why I'm fucked up. I looked at the nurse, I said, "Dude, check my potassium now." Guess what my potassium was?
What's it say? 2.8
Is that good, bad, or ugly?
Ugly.
Ugly. Miss Howard was trying to check out. No, baby, that's way too low. That's way too low. I felt every single one of those on the bus. In fact, I'm having anxiety just looking at it. If this continued, it would have been called a code. It would have been VTAC.
Now they use Fona, instead of Mona.
Yeah, and I don't like it because fentanyl doesn't do all the magic that morphine does. And it's a hell of a lot easier to kill somebody with fentanyl.
Yeah.
Huh?
I had a patient one day that was brushing his teeth.
Yes. Easier, listen, my darlings, my little chickadees. It's easier to cancel a code than bring back the dead.
Over there, pissed off.
You call the blankety blank code, you can always go, "Oops, I sorry," than to bring back the dead. All right? Cancel it if you have to. True, this is torsades. It is a version of VTAC. It means, torsade de points means to twist the point. I've seen it twice in my life. Once, with the guy's chest open. The doctor was doing a bypass surgery. He'd already put him on the heart-lung machine, gave a little bit of medicine, put the heart to sleep. He did the bypass, and then he put him back off the heart bypass machine, and he took the little Band-Aid paddles and went zip and tried to bring the heart back, and instead of the heart going like this, it did this in the chest. Once you see it, you'll never forget it. To twist the point, okay? The second time I got to see it was over on Freaky 4 West. For anybody who knows that
I
facility.
hate for West. That's like the worst unit to go to.
You know,
The nurses hide from you.
I affectionately called that unit hell.
The nurses hide from you, like you're looking for.
Pulse, check a pulse. I don't care if they have a pulse in their hand. I don't care if their hand's perfused. I want to know their head's perfused. Why did I check groin? Because if I've got a pulse here, it's already gone up the aortic arch, it's already perfused my head, and it's already perfused all my vital organs
So
before
what
it
does
gets
the
here.
magnesium sulfate do?
Resets it.
By doing what?
This is irritability. This is severe irritability in the ventricle. And it's caused by hypomagnesium. So we treat it with
Hyper.
IV magnesium. Does that make sense? That was a good question.
For most, I have a question too, so like most dysphoria, so like even if it's like AFib, or all that, should we just go to the NP just to see where their electrolytes
I
are?
wanna know where their
sitting at?
electrolytes are.
Because typically it's like an electrolyte imbalance going on, cause that's like the something.
99% of the time when the heart's getting pissed off, it is electrolytes related. The other 1% is mechanical. Okay, so VTAC, check the pulse. If it ain't got a pulse, you better give it one. Okay? VTAC and VFib are both shockable rhythms. Shockable rhythms. That means slap the pads on them, swirl it up, juice them. Okay? I would not shock this. I would give it CPR, but by God, I'd give it MAG.
Would you have to, I mean, it's already,
No, I wouldn't shock it. I'd give it MAG.
oh, okay, so.
This needs MAG. Torsades needs MAG. I always laughed when I was in school because when I was learning all this stuff, they had that show called ER. And they'd have a patient come in with this on a monitor. And then they'd shock it. No! Dad! There is no electricity going through that heart, is there? Alright, do not confuse this with that. That is ventricular fibrillation. The ventricle is doing this. Any of you guys ever watched Princess Bride?
Yeah.
This is mostly dead. Alright, this has no squeeze. They're not gonna have a pulse, it has no squeeze, it's mostly dead. Shock this, not this. Alright, neither one of them's gonna have a pulse. This and this, because it has no pulse, dead people get epi. Dead people get epinephrine. What is epinephrine? Anybody remember?
Adrenaline.
Fight or flight, it's synthetic adrenaline, very good. It is synthetic adrenaline. I'm trying to convince anything in there to do its job, especially when we're here. You good? Is any questions about what I just went over? Dead people get epi. If it doesn't have a pulse, give it one. If it's not breathing, you best bag them and help them breathe. All right? My God, I can't believe it.
On next week's test.
And it's got a whole mess of that on it. What is it? P wave. What's it point to?